I just want to welcome everybody to today's Digital Practice Week webinar. This is about ethics and safeguarding in the age of AI, and we're really lucky to be joined by colleagues from Sheffield University who've done lots of work around this. Some slides from Lucy, and I think she's posted also in the chat an opportunity for discussion for everybody towards the end of the session as well. So without further ado, I will pass over to you, Susan and Dennis, and thank you so much for joining us.
So I'll introduce myself now, and you'll also hear from my colleague Susan in a few minutes, and she'll introduce herself when I hand over to her. I'm Denny Newman-Griffiths. I'm a senior lecturer at the University of Sheffield and part of our Center for Machine Intelligence, where I lead on AI for Health. And what we're going to talk about today, what we want to sort of share with you and discuss with you is work that we've been leading over the last year and a bit or so on trying to work out what it means and what it looks like to do AI responsibly in practice with local government. And obviously, I know today has a particular focus on social care settings, so we've tried to sort of pull out some things that are particularly salient to that. But I think a lot of what we have been seeing and a lot of what we've been talking about and we'll talk about today really cuts across different areas of service delivery. So just to give you a quick structure, we'll talk you through a couple of different projects, research projects that we've led out of the University of Sheffield that have been the background for this work, and then talk a bit about some of what we've been doing with our local authorities, primarily in South Yorkshire, over the past year, and then sort of going forward over the next 6 months to a year. So I'll kick us off, first of all, before we get into the research, by just giving a bit of a grounding, because we kind of tend to throw this phrase of responsible AI around a lot. But you'll have heard ethical AI, and you'll have heard other kinds of, I'm sure there are other buzzword phrases out there for it, but it's useful to start with a bit of a sense of what is it that we're trying to mean by this. So the way we approach responsible AI in our work is thinking about responsible use of AI technologies, where that use is effective, that it does the things that it's meant to do, that it's done in an ethical way, and we'll get into a bit of what that means, and that it achieves equitable outcomes. So we sort of think of it through these 3 E's of effective, ethical, and equitable. So start by talking about the project that in some ways kicked off a lot of these discussions, which was something that we ran called FRAME, for Framing Responsible AI Implementation and Management. And this was funded by the Arts and Humanities Research Council as part of the BRAID Responsible AI Initiative. What we were doing in this was really looking at how responsible AI is defined and actioned in terms of organizational policy. So looking at how current AI policies represent AI in a responsible way, who's involved with shaping responsible AI, and what we actually mean by it. And so we worked with a cross-sector set of partners here, and Sheffield City Council was one of our core partners on this project. We've included, and you'll have these slides later, we've included a link to the FRAME website. You can get on there and see sort of much more detail about what we've done and the wonderful team that was involved. But a couple of things that we can highlight are that, first of all, there was what we described as a cacophony of, when you looked at an AI policy, what was it saying? So we did an analysis of 80 different AI policies. This was across sectors, so some in government, many in some in the tech sector, some in law, et cetera, looking across different settings and analyzing what different dimensions of responsible AI these policies addressed. And what we saw is that they're wildly inconsistent. So we saw 80, we looked at 80 policies. The most frequent thing that we saw was transparency. That only occurred in 60 of them. And realistically, that was about 50 different definitions of what transparency is. So there's quite this wide variation in terms of who is responsible for defining what responsible and ethical use of AI looks like, who is involved, and what's involved in delivering that. And we see that when we spoke with people in our partner organizations, that responsibility for AI is diffused quite widely around organizations. And this is certainly the case with local authorities, where there's no particular single owner, single source of AI decisions and impacts. AI has a role and has an impact and has influence from data analytics, operations, strategy, sort of all the different components of an organization. And that perceptions of what AI is and what responsibility means will vary dramatically from person to person, even within the same organization. And what we saw as well fairly consistently is that trying to put responsible AI into practice is in some ways much more of an integration problem than it is about defining sort of the new things that one should be doing. So it's about understanding, what do your existing policies already address? How do we integrate new ways of using AI with established ways of working and integrate with the organizational values that each individual is trying to deliver against? And we saw that this was really where the difference happens in terms of being able to accomplish those 3 E's that underpin responsible AI. So our key insights from this work have been that responsible AI comes, first of all, from a focus on local context. So thinking not about what's the global practice, certainly across the nation, but even within necessarily within a local authority, having one approach across all teams is not going to work. But grounding the use of AI in the specific practices, the specific problems that a particular team is working with, focusing on what you want that AI use to help accomplish, rather than we want to innovate with AI because AI is there and should help with innovation. That's really where we start to make responsibility and effectiveness tangible. And thinking organizationally as well, that there is this real challenge that because AI draws across and influences on many, many different components of any organization, working on responsible AI means and requires working across silos, and this requires some real intentionality of how to mobilize these kinds of efforts. So part of what we've done in this work is started to put together, and this is something we're working on building on now, started to put together a bit of a sense of what are the kinds of skills and competencies that go into being able to achieve this cross-cutting approach to responsible AI. So we've initially broken this down into 5 kind of high-level competencies, thinking about what should a team be able to address, not an individual, but a team working with an AI implementation, thinking about where an AI use fits, how you define the problem, what particular kinds of AI tools may be involved in that or may be a fit for it. There's many, many different kinds of tools and technologies out there. It's not just ChatGPT and Copilot and so on. Thinking about the data that you have and thinking about what you're trying to accomplish. So with that, you'll pause hearing from me, and I will hand over to Susan to introduce herself and talk through the other project we've been drawing through a lot in this work.
Thanks, Denny. So yeah, my name's Susan Oman, and I'm here to talk about a project called Public Voices in AI. So Public Voices in AI was a year-long research project. It had a £1 million investment, which is like a huge win for participatory AI and social research in AI. And could you move on to the next slide, please, Denny? Thank you. And it was really driven by a recognition of the need that we need to change the way that AI decisions are happening, the way that AI is being developed, and the way that AI is being deployed. So rather than coming from the standpoint of saying we need to stop AI, it's all out of control, it's really bad, we were coming from a far more pragmatic point of view, which is we know AI has positive opportunities, especially for those most marginalized, but we also crucially know that those most marginalized in our society are also those most disproportionately affected by AI. And that is why we need to make sure that how the public feels about AI, how it feels about specific systems, specific use cases, is really crucial to driving forward policymaking in the field. So we proposed this huge empirical research project, multi-method, multi-site, up and down the country, to gather all of these voices from very diverse members of the public to understand the gaps that we had in knowledge about how the public feels and what the public might want for AI in public service delivery. Next slide, please. So then, the first thing that we did was a public attitude survey. It's not the first public attitude survey, but it's the first public attitude survey that was truly trying to reach diverse members of the public. So we invested quite a lot in a sample boost to speak to marginalised areas of the UK population by class, which was we used the proxy of income and joblessness together with Black and Asian minority ethnicities. And what we saw in our sample was a number of changes in trends, because this is the second wave of this survey. So we saw that concern for AI is raising, but crucially also the public wants governance to intervene in this space. And that's gone up quite considerably. And in fact, this survey was run almost a year ago now. Ada Lovelace, who led on this part of the Public Voices in AI, have run subsequent surveys that are more specifically focused on the public attitudes towards public sector AI uses. But there was a YouGov poll last week that shows that the public wants regulation at like 90%, not even 72%. So if we are to think of those figures as kind of measuring change, what we're seeing is increasing awareness of AI in our citizens, but also increasing concern and an increasing need for responsibility to sit within governance frameworks. Next slide, please, Denny. So we also surveyed experts. So these are self-defined experts, which is always, you know, asking anyone to define themselves as an expert is a dangerous game for a social scientist, because you could just, you know, many people think they're experts. But we asked people if they were researching AI or developing AI. And so around 4,000 of these experts, I shouldn't do that because it does make it look like it's a less serious survey, of these experts responded to the survey. And what we found was that people who declare themselves as experts in AI have very little experience of working with the public. This reinforced what we hypothesized, which is that the people who are building AI systems and deploying them don't necessarily understand the public that they are building systems for, or the disproportionate effects that they may be having, let alone including public attitudes in this work. So instead, what we see is, like, when AI developers and deployers are thinking about the general public, they tend to rely on oversimplistic assumptions, which are like, oh, the reason that the public doesn't trust the system that we've already invested £5 billion in is because they simply don't understand it. So what we need to do is invest on all of this trust work to make them trust the things that we built, rather than, as we argue, including the public as early on in the systems that you're thinking about procuring, developing, and deploying. And then the piece of work that I led on was a review of previous research that had, in fact, included the public in discussions of AI. Now, this was a very broad remit. Some of it was about very specific systems that were being used with very specific populations. And so, you know, that piece of research had a tiny sample about a very specific system. And some of these pieces of research were, again, kind of national or cross-national surveys with like 30, 40,000 people in that panel. And unfortunately, this evidence review also found that even when the public is included in research to understand AI better, it's not included in very good ways. So when you start to unpick that research and the methods, when you start to look at the questions that were asked to the members of the public that were included, or if you look at how those findings are representing the public, you find that the public isn't, you know, their views aren't represented, and certainly minority populations are completely underrepresented in findings and the representation of recommendations for policy. So what this shows is the importance of joining up, like, what experts think and what the public thinks, if we're going to really think about doing responsible AI in a meaningful way in all contexts, including in your own local government context. Next slide, please, Denny. So alongside these very large scale pieces of work, we also did some small scale community-based, place-based work. And this again was the first time that place had been used as a lens to really understand how different people feel about AI. So we did some research in Southampton, some research in Brixton, and some research in Northern Ireland, and some other places that I can't remember with the jet lag, sorry, which is silly because I heard about it so many times last week. But what this reinforced was what we already felt that we knew, which was that people do want to be consulted on how AI is developed, and they want to be consulted early, but also we want to get beyond this point where people think that the public isn't capable of having meaningful discussions about AI because they don't understand the systems well enough. That's absolute nonsense. The people that we spoke to really understand AI in the social context, and they're really excited to talk about it. And they have really sophisticated understandings about how AI's uses in different places and different contexts affect not only themselves, but they can see the impacts on different populations. And as a result of that, people do actually want to kind of sit and cogitate on what AI for the public good might be. And I think that's a really positive message to come out of a whole bunch of negative stuff. But that also crucially, you know, we talk about context as academics a lot, but it isn't just any context, it's the importance of the locality and place to understanding these things. Next slide, Denny. So as I mentioned, Ada Lovelace, who led on the public attitude survey for Public Voices in AI, have done subsequent work to understand public sector uses of AI. And there's some links at the bottom of this slide that we're obviously going to share with you later. So please don't struggle to write down a URL because it will be made available to you. But these results don't necessarily differ that much from what we found on the main project, but they are specifically about public sector uses. So there's no single view of AI. Public perceptions are really nuanced. They depend on context. Who you are, where you live, and what you've experienced really shape not only your opinion of AI, but your expectations for it and what it can do for you and the rest of society. People have a really clear moral compass about, you know, private providers, especially in the public sector. They don't like it, and they don't like the big names. They don't trust them, and they don't trust the power and the profits involved. Like, they really get that's going on in the background. So while people do support AI in public services if it's going to improve people's lives, make things more efficient, they want they want the support that they give to be backed up by evidence and to be able to understand what's really going on and crucially who's involved. And yeah, finally, that social impact matters. You know, people are against AI that is going to be unfair on certain parts of society. So hopefully that's given you some insights into what we found on that project. And I'm going to pass back to Denny now. And thank you. These are just some of the organisations that are involved in that huge research project.
Well, thanks very much. So, oh yeah, do you want to say a word about the Webtoon before we go on?
Yeah, so there is a follow-on project, which is an AI awareness campaign. And sorry, I did mean to mention this. So I've spent the last 6 months since Public Voices in AI responding to recommendations, which are that the public do want to know more about AI and they want a general awareness to guide their personal uses, and also public sector and other systems that they may wish to avoid. So I've spent the last 6 months actually building some resources using the same artist that made the illustrations here, following recommendations from Public Voices in AI. So we got to pre-launch that at the AI Summit last week to the AI Minister and the Deputy Prime Minister, which was really exciting. But we launch this next month, so watch this space. Thank you very much, Denny, for reminding me of the important bit. Thank you.
Of course. So yeah, what we want to then talk a little bit about, just to wrap this up, is what we've been doing on trying to take the insights and the work that's come out of these two projects, as well as various other things that we do, and bring it into local government, particularly in South Yorkshire. So we have established this partnership on responsible AI across local authorities in South Yorkshire. And we've been running through this a couple of different, so we've run so far a couple of different workshops with local authority officers, with folks involved in service delivery and so on, to try to understand, to share what's been coming out of this research, but also to try to understand what does responsible AI look like in the working practice of a local authority context. Some of the key things that we've learned, and this is all summarized in a report that is currently going through a comment period among the folks who are participating, and we're hoping to publish next month. So we'll update you when that's out there. Some of the key things that we can draw out of those conversations so far are, for local authorities sort of looking internally, some of the key priority areas are on clarifying leadership and accountability. So how is, particularly around decision-making around AI. So this isn't just sort of use of AI in decision-making, but also things like procurement, where is an AI application going to be used and how, who sort of sets the expectations and the good practice for that. There's a real lack of clarity, and this is not a local government specific problem. This is a cross-cutting issue. There's a lack of the clarity of who is responsible, who is taking the leadership on that. What we see as well, and this is something we commented on earlier, is that effective use of AI comes from having a clear purpose and specific applications that it's being put to, so being led by the problem that you're trying to solve. There are a lot of clarifications that are needed on just some sort of basics of data security and information governance when interacting with AI. Not everyone necessarily knows that if you stick something sensitive into ChatGPT, OpenAI has that data, and it has serious implications for GDPR and other data regulations. We see that there's quite a bit of variation across teams and departments, both in terms of how AI is understood and also how it's used and sort of what the practices are around that. Some of that is natural because, of course, there is this variation in terms of the specific context and the specific purposes, but getting a good understanding of what that variation is and how to build a shared understanding and a shared practice around the use of AI across those different contexts is a really key action area. And I think one of the things that's come up for us repeatedly and is sometimes a bit of a difficult question to action is how to put in place guidance on when AI is not the answer, because there are times when AI is not the answer, and getting both buy-in to be able to say, yes, AI is not the answer for this particular application, but also to establish clear guidance on why is an area that I think needs more kind of development of practice and sharing across local authorities. So thinking across local authorities, one of the key things that we see and that we're working on creating is knowledge sharing structures. So this is also leveraging existing kinds of structures like the Local Government Innovation Hub, the Local Government Association. iNetwork is one that we work with in the North and Northwest. So building these kinds of knowledge sharing structures as we're doing today for building transparency and for shared learning around AI use. And feeding that into one of our kind of priority areas is thinking about training and skills development on both the fundamental understanding, the basic and critical literacy around AI, including things beyond generative AI, and also around these differences in how AI is used across different business processes and what that means for individual users and for local authority writ large. And the final piece then is thinking about the external priorities. So what are the externally facing or externally oriented challenges? The first is navigating capacity barriers to doing the kinds of public inclusion that Susan was talking about from the Public Voices in AI project. This is not an easy thing to do. Local authorities have a lot of expertise in doing this, but there are significant capacity barriers that need to be navigated. So sort of building that understanding of what are the key priority areas, what are the drivers for doing that public inclusion, and how do we do it in a proactive and sustainable way is a really important part of this. There's a part of this that's about public awareness raising. This is some of what the work that Susan mentioned around the follow-on work from Public Voices in AI is intending to do. So see upcoming exciting bus stops launching next month. As well as getting a better understanding of who are the stakeholders who are involved in these different kinds of areas and applications of AI, both internally and externally in members of the public. Just to summarize the key kind of recommendations that we're making in this report that hopefully we'll be sharing with you in a month or so, are these 6 things here. So that where we see key actions for local authorities to take are, first and foremost, to make sure that you're taking a problem-oriented approach to any kind of discussion of AI. So it's not about how can AI help us innovate in this space. It's about what is it that we're trying to accomplish, what's involved in doing that, and where in that process, if anywhere, does an AI technology fit. Taking that orientation, being driven by the problem, is how we've seen this consistently, how organizations are able to get effectiveness, ethical practice, and equitable outcomes out of the use of AI. Along with that is building some of this internal definition about who is making decisions on AI use and how, working to build these kinds of communities of practice. So thinking about keeping these kinds of conversations going among professionals in local authorities, and identifying, sort of building from those communities of practice, identifying what are those needs for skills and literacy, how can we build as well the proactive strategies for public inclusion in AI discussions. And the final piece is getting, along with that problem orientation, a slightly better sense of what the intended impacts and benefits are of AI, as well as the risks. And we talk a lot about the risks. And I think a lot of impacts are often approached as this is for efficiency, first and foremost. And efficiency, what we've found is that efficiency is one driver and is one significant potential benefit, but there are many others that can come from using AI, particularly in very challenging processes. And so doing the work of getting a better understanding of how can AI use benefit a particular problem area can make a really big difference. We are, as we mentioned at the beginning, building some ongoing work in this partnership. So we're starting a new workshop series, which we're launching actually just after this, with our local authorities across South Yorkshire. So we're organizing 5 workshops over the next 4 or 5 months with them. We've highlighted here some of the kind of key potential topics for those. So thinking about communities of practice, skills for local authority professionals, working with the public, writing a good AI policy, which is not a straightforward thing, and thinking about how we sort of bring these insights and these ideas into a theory of change. We also have some work that's ongoing around responsible use of AI in SEND policy and practice that's running alongside the current discussion around the SEND reforms. So there will be a national survey that will be launching in March, and would love to get input from relevant folks, from you all on that as well. And what we want to highlight just last is that we have an upcoming workshop that we're running through a different project that is actually about this problem of measuring impacts and benefits and risks. So one of the challenges that we've seen is that it's rather difficult to be able to define what we should be measuring about AI use in the public sector. In anywhere really, but particularly in the public sector. So we are running a couple of workshops, one with local government and one with central government, trying to get a better sense of what is it that we need to be discussing, what is it that we need to be able to measure for responsible AI. And our local authority workshop will be on the 19th of March in Sheffield. The location here is just a few minutes walk from the station. We've got registration form and information here, and we'll share this around later with you as well. We'd love to have a couple of folks from you all come and attend and join the discussion. But let's wrap up with that. We've got our contact information on the slide here, and obviously we've got time for Q&A now as well, and we'd love to get your thoughts on any of the things we've talked about. Thanks very much.
Brilliant. Thank you so much, Danny and Susan. That was really, really interesting, especially things that I picked out, that diffusion of authority around AI. That's something that we've seen when we've joined other networks. Some it's in central IT&D, some it's within the departments, which is a bit of the approach that we're taking. And really interesting about you saying about integration with existing policies. That's been our general approach for around digital practice, so updating our operational instructions rather than creating separate ones. the real importance of training and development, and building communities of practice. That's something that Emma and I are really keen on, building a champion network within social care and early help, but also thinking about building that wider network with other local authorities. And then again, really interesting thinking about measuring impacts, because we've always been quite clear it's not just about that productivity angle and improving quality. It's about well-being. It means that our practitioners can spend more time effecting change within children and families, which is why they do the job, not to sit in front of a computer. But yeah, I thought, yes, really useful. I just wondered if you, before I open up for others, did you get as far as finding any correlation between really well considered and jointly developed or co-produced governance and the attitude towards AI from the public? Or is that something that might come within time?
Given the dates of when we did the Public Voices in AI project, there weren't really many examples of co-produced policy that you might refer to as best practice. If you like, that's kind of why we did the project, was to prove that that's what we needed to move towards. So at the moment, that is not a resource that is available, but it will be available soon. Even if we don't make it, someone else will be, because it really is on every, the thing that everyone is talking about at the moment. So I'm afraid I can't share it right now, but I know that people are talking about it, Lucy.
Thank you. Right, does anyone have any questions for Susan or Denny? You can put them in the chat if you don't want to raise your hand. Emma, have you got anything?
It's really interesting, isn't it? And I think, Lucy, off your point as well, in terms of, and you've got the technological side of AI, and then you've got the practice side, and trying to find people that can marry the two. I think we come from a very practice angle, and our knowledge of AI is user-led. It's, we don't understand the ins and outs. So don't know if you've got any advice around that in terms of kind of the expertise that's needed to write these policies.
Yeah, it's a really good point, and it's something that we're continuing to try to look at, and that's to some extent. So I highlighted briefly that sort of competency framework, thinking about AI in teams, and that was actually a lot of the motivation for developing that competency framework, was to be able to say, not everyone needs to have technical expertise anymore. Sometimes you do, for some purposes you do, but very frequently what we need is this broader sense of just a practical knowledge of how do you work with AI and understand its risks and so on. I think what we've seen across these discussions and across other work that we've done is that you do need to have some degree of technical expertise in terms of particularly like the information governance within a council. What are the existing, like, where is data being stored? How is that being managed? How does that interact with where, for example, a particular AI system might access data? So being able to know, is a particular system that you're looking at in procurement, like, is it going to store data on servers that are located in the US, for example, because that starts to become that can start to become a real problem. And that there's not always clarity on that. So I think really, what we're seeing is that having that deep technical knowledge of how AI systems work isn't often that important for a kind of operational policy, because the operational policy is much more about what is it that you're trying to do? What are the kind of decision-making guidelines that go into managing a particular AI application? Where that technical expertise does start to come into play is when you start looking at more kind of bespoke applications of AI. And this is thinking especially about kind of non-commercial, non-generative AI. So if you're doing machine learning of a particular problem, you have a lot of historical data and you want to learn from it. That's where you need that to bring in that technical expertise. But often the most practical way to do that is actually via consultancy, is to go out to someone externally, some councils will have internal like data science teams, but often the practical way is to go out for that.
Thank you. That's really helpful.
Yeah.
I think Erin's got a question.
Do you want to read that out, Erin? How have researchers or other local governments gone about gaining public voice? I'd like to gain a better understanding of your focus on the responsible use of AI in SEND policy. Can you give an overview on this?
So I can speak to the second part of that, and then leave the first part to Susan. In terms of the focus on responsible use of AI in SEND, this is what we're looking at is practitioner and professional perspectives on basically what are the key problem areas in SEND policy and provision where AI might be of use. So EHCPs are the sort of most salient thing at the moment. Everyone is looking at those, but there are a lot of other sorts of potential places where AI is being explored and discussed across different parts of SEND processes. So for example, provision of individualized teaching materials. That's a real potential area that's a little bit under discussed. So what we're trying to look at in this work is getting a sense of what are the kinds of application areas that professionals working in the SEND area and this sort of SEND ecosystem are looking at. What are the intended benefits where they might see AI helping, and what are the kind of key risks and areas of trust and fear that they are perceiving, so that we can then take that, and we're working with the Department for Education on this, take that back and get with a little bit of a better sense of what's the landscape of those discussions to try to then see how we action that in terms of skills development, shared policy development, and so on. So it's about sort of observing what's the current state of discussions on that. Susan, do you want to take the other half of it?
Yeah, so obviously different councils have different things in place. So a number of councils that I've spoken to previously may well have different kind of like patient involvement groups. So you might, for example, have people who claim welfare locally or need help with housing locally who are disabled. So they might be a working group that comes together to advise the council regularly about one part of civic life. And so what you often find is that when it comes to things like AI policy, councils are using those community groups that they already have feedback mechanisms with. I mean, other mechanisms that are used internationally are some have done public consultations with the citizens in their local area that are done digitally, or something like a town hall where you invite people within specific towns across the region to come and hear about what your vision for AI is in this particular domain, so that they can then offer their feedback. So there's a whole bunch of public consultation mechanisms that are available to local councils, and not all of them are expensive. But I guess it depends on thinking about the infrastructure that you already have locally for gaining public voice to advise you.
That's brilliant, Susan, and we'll touch on that next in the next bit when me and Emma reflect on what we've heard. Has anyone else got any other questions? See the chat. Okay, we will move on to mine and Emma's section now. So, can you all see the slides? Brilliant. Okay, so what really came through, I suppose, was the importance of the human side of AI and how people feel about it, what they worry about, and the conditions that might make them feel safe and included. And for us in East Sussex, that's exactly where our focus needs to be as we begin to think about AI in the context of children and families. And so with that in mind, Emma and I are going to take the next part of the session to look at what the insights from Sheffield's research and from what we've learned from other local authorities means for us in East Sussex, especially when it comes to how children and families might feel about AI, how we can talk about it clearly and ethically, and how we approach using it with families in a way that can empower them rather than disempower. So, first of all, reflecting on a frame that Danny talked about, the need to focus on local grounding in practice, being problem oriented. I mean, this really reflects the approach that we've taken in children's social care and early help about what's going to work best for East Sussex, where AI can make the biggest difference in terms of reducing the admin burden on practitioners and mean that you can spend more time with children and families. And I've also thought it was interesting that there's that misconception that if the public simply knew more about AI, they would feel more comfortable about it. And actually, that comfort isn't about that technical knowledge. It's more about trust, that lived experience, and whether people feel they have power or influence over how AI is being used. And again, Sheffield's work's also highlighted that when organisations do consult, it often excludes marginalised groups, so including communities like Gypsy and Roma families. And that exclusion then doesn't just reduce comfort, it reinforces those existing power imbalances and can deepen mistrust. And so there's a real call to us to really consider meaningful co-production, including those more marginalised groups. And another really relevant insight is that families may already be using their own AI tools, sometimes to record meetings or generate their own summaries. And that raises really important questions about privacy, data security, as Denny talked about, in terms of once you put something into the likes of ChatGPT, and expectations. So it challenges us to think about how we explain our own use of AI really clearly and consistently. And finally, the research really showed that strong governance is absolutely essential for public trust. People want transparency, they want explainability, and they want to know who is involved and have a say themselves. So this aligns really closely with our own approach, being clear about what AI can do and what it can't do, and really grounding everything in safeguarding ethics and professional judgment. Emma.
Yeah, so we've had, obviously, thinking about the insights from our learning and from other local authorities. So one of the strongest themes from colleagues in other local authorities is around the value of developing that shared learning spaces. So places where we can compare our approaches, avoid duplication, and strengthen our governance together. It's been really helpful to kind of get a grasp of what other local authorities are doing and sharing that. So carbon footprint and responsible prompting is also something that's really key. Several councils are beginning to think about the environmental impact of AI. For those of you that joined the session yesterday, we touched on that in terms of how its use of water, how it can, it uses more water than a Google search does, but there's a lot that's going on to try and improve that. And Microsoft are aiming to be carbon neutral with its tools at some point. So we're kind of really keeping an eye on how that progresses. So this also reflects our internal reflections. When we avoid image generation that uses a huge amount more than just a worded prompt. We also encourage batching prompts together, so asking a few questions in one prompt rather than several, and avoiding being polite, so don't say thank you, which can be hard to do sometimes where you get a good result from it, but if you say thank you, you're asking it to generate another prompt. Also narrowing down our searches, so if we're wanting it to look at something, we might say this likely happened in the last 3 months rather than all my documents from the last 13 years. I think I've been with East Sussex now. So really just helping think about not overworking it. And this is of course very early thinking, but it's part of us being having a responsible by design mindset. So governance as a shared foundation, we're thinking this really aligns with Sheffield's point about strong governance as being the basis for trust. So councils we've spoken to are extending that into more practical collaboration. So really wanting to align policies, shareable templates, joint data protection impact assessment learning, and more. So implications for us, we really want a family-centred, transparent, co-produced approach. We've got a bit of an opportunity. I mean, me and Lucy this year are looking at how we might roll out AI in visits in terms of recording families and transcribing. We want to make sure that the starting point of that is engaging families, so that this isn't something that just is done to them. We're really keen to get their views, and then we expect quite a broad range, from some that would really welcome it and some that will be quite fearful. We want to be clear what AI can and cannot do, those ethical boundaries that we have in our guidance, i.e. it does not make decisions. So just being able to have some kind of working document that can be given to families to say this is what it will and won't do. And that to be backed by our governance, have clarity, involvement and equity to underpin how we introduce it to children, families and communities. And also thinking about, for any of you that joined yesterday's session, around supporting children and young people to use AI safely, but also our families as well, and how those conversations can be had for a dual purpose, to explain what we're using and why we're using it, but also how they may use it themselves. And we've also started building a network with our neighbouring local authorities through the Principal Social Work Network. So we're hoping to have a bit of a South East working group where we can have a bit more continuity across the borders.
Brilliant. So in terms of how children and families might feel about AI, as Emma said, it will be mixed, but it was a big theme in the research that people's reactions to AI are shaped by trust, power and control rather than that technical understanding. So for families who are already navigating services, AI can produce an extra layer where they feel unsure who is in control or how their information is being used. So families may worry about misuse, surveillance, being misrepresented, or losing control over their information. Families may have really real concerns about things being recorded incorrectly or taken out of context, although some might actually find it reassuring. So an extra pair of ears that is capturing everything accurately. We also need to remember that families may be using AI tools themselves, possibly not understanding fully how it works. And Emma will talk more about this in a minute. And power imbalances really shape how people react, especially when there's a difference in digital confidence or understanding. For some families, AI could feel like another system they don't fully understand and can't influence, which can then deepen that mistrust. And the research tells us that marginalised groups are often excluded from consultation on AI, and that means their concerns aren't heard early, and they may feel less able to question or challenge how AI is being used. And finally, if we use AI-enabled tools to record or summarise, families may feel, if you're going to record, so are we. And their tools may produce very different outputs to ours, and there are issues of data security, as I've already said, and that's a real challenge for transparency, safeguarding and expectations, and one we need to have a really consistent position on in East Sussex. So a lot of this comes back to trust, how families understand what we're doing, how involved they feel, and how confident they are that AI won't be used to them, but with them. And that's why our approach has to be really transparent, rights-based and co-produced. So how will we talk to families about AI? Sheffield were really clear about that public trust depends on involvement, and that consultation often excludes those most affected. So rather than us deciding what families need to hear, we want to ask them directly what feels important, what would help them feel safe and in control, and what language makes sense to them. And we think it's going to be important to avoid jargon. A simple line like AI can help us write or summarise things, but human professionals always decide. And that reinforces the East Sussex ethical boundary that AI cannot and will not make decisions about children and families. And it's going to be really important to be upfront about what AI can do and what it can't do. So it doesn't assess risk, it doesn't judge families, it doesn't decide outcomes. And then this clarity can help reassure families that professional judgment still sits firmly with practitioners. Families need to know when we're using AI responsibly, so we need to explain how we protect privacy, how we check outputs for bias or error, and how we review everything before it's used. And that links strongly to that point about strong governance being a real prerequisite for trust. And we need to think about the benefits for some families. This isn't about selling AI, it's about showing how it could help. So clearer letters, more time focusing on the conversation, better preparation for meetings. The benefit is going to have to feel really real and relevant to them rather than abstract. And we need to be really transparent about the risks that could actually help build trust. We'll acknowledge that AI isn't perfect. For example, it can make mistakes or misunderstand wording, and that's why humans always check and edit what it produces. And that's where relationship-based practice is really central. The trust and relationship you have with the families you're working with will help you have those open conversations about this. And as a council, we need to be really clear about who can record, what tools we're going to use, and how families can raise concerns or ask questions. And that clarity will hopefully reduce misunderstandings and that power imbalance. And finally, none of this works unless practitioners feel confident about having these conversations. So we want to hear from you as well. What would help? What feels tricky? And what support or scripts would make these conversations easier?
We also really want to think about that it's not just about our use of AI, but how we can, anybody that joined yesterday's around children's use, it's how can we empower families in the use of AI and help them to use it safely. And we were very early on in our thinking with this, and we're really keen to get feedback and any other ideas from people. But we're kind of making the assumption that some people might find that the meeting is far more transparent if it's being recorded, if there's that extra pair of ears. I went to the GP the other week and they said, do you mind if I use AI? And I was like, absolutely, because I'm looking at a very busy practitioner who's, going from appointment to appointment and is trying to listen and trying to type notes, and actually having that there as well meant that I felt that there was less likely that something I said would get missed. Some people may feel that, they may not. They may feel that the practitioner is less able to twist their words if there's this extra tool that's helping to record the meeting accurately. So we want to see how it might help with that, and also for them to give the practitioner a bit more focus. So you can say, look, I'm not going to sit here and write notes whilst you're talking. I'm going to sit and listen. You've got my full attention. That's going to do the note taking. And Mel, have you got a question on that?
Oh, just building upon that, just wondering, like, I think that's a really good example. And I wonder, but that's kind of based on your experience of using AI, isn't it? And that you have that trust, because we've spoken about trust being so important. And I wonder how that would be, felt and understood by someone who is quite fearful of AI, or someone that perhaps has experienced something really quite negative online, a child or young person who's had something really awful happen, with their use online so I just think it's really interesting that there's almost going to be a whole spectrum of perception and feelings about it, isn't there? And it's the same in our workforce.
Yeah, and I think you're absolutely right. I had the awareness of, like, maybe a year or two ago I might not have felt that, but actually I hadn't really thought about what if somebody has had a traumatic experience as a result of AI, and the additional layer that you've got there. So yeah, that's a really good point. Thanks, Mel. Polly, did you put your hand up next?
Yeah, hi. It's struck a chord with me, this conversation. I'm from Helfersting, but we're an integrated service, but we are way behind East Sussex County Council. They are far in front of us, but we're hoping to catch up. But I think it's really interesting, that kind of mistrust. We've tried to introduce just using Copilot for recording transcripts of supervisions, and then using Copilot to do staff supervisions, and we've met quite a lot of resistance from that. So any tips on that would be great. There's a big fear about data being stolen, I think, is the main fear that I'm hearing from that. And we haven't even got anywhere near the patients yet. So we got one hurdle at a time. But
Yeah.
it'd just be really interesting to know like how best to improve that trust.
And I think that's really key, and that's one of the reasons why we went with let's start with staff supervision, because we've got practitioners who are capable of saying, no, I don't agree to that, I don't want this recorded, and that's well respected. We don't want to put families in a position where they're like, I don't know what's about to happen and I don't feel I've got control. And we're really keen to hear what the feedback is. And there is something strange about being recorded. This whole session being recorded makes me a bit more conscious of what I might say, but why, I don't know. It's just because I suppose we're not used to it. It's that something that's new. But
my gosh, what a difference it makes in terms of documenting their supervisions and documenting them clearly and capturing everything that they said instead of getting things back saying, I didn't say that. You haven't understood that right. It's like, well, you did.
and maybe, you've answered your own question in it, is that's the starting point, is getting that feedback of like, what is the benefit? Because that's where people get their buy-in. I've spoken to some social workers that are like, no chance, I don't want that. And then when I've talked through, it means that your manager is listening to you rather than scribbling down notes, and your conversation is free flowing. You don't have to pause and they go, hold on a minute, let me just write that down. It's the more people experience that, and also experiencing the tool themselves. So where we're saying use it lightly in terms of editing your notes and stuff like that, you start to learn what the system does, and then you get a bit more. So as much
absolutely.
as
we're
much
so
as
behind, we're desperate to jump on the train. I've got meetings booked, so that's good to help me with that. But
and I think it is an incremental, slow process. This is such a big bit of technology that let's kind of take it slow and have that caution, but intrigue and curiosity, and build the steps from there.
And it would just be so interesting to think about what other, in the earlier talk, about what other tools could be used, because Copilot's really good for that sort of thing, but a bit rubbish for building pathways and things like that, organizational stuff and visual, like really good visual charts and stuff like that. It does okay, but it's not as good as some others. And there's some great other tools, but it's just about getting that agreement organizationally about what tools we could and can use, So it's really interesting. Thank you. I'll shut up now. But thank you.
do email me and Lucy if you've if you know of tools that you think is worth us having a look.
Gamma is really good for making patient leaflets, and then it's really fantastic. So I can share some of that with you when I meet up with Lucy.
Brilliant.
Cool. Excellent.
Susan.
Hi, I don't want to take up the time and the space.
No, go for it.
But I just had some reflection. So although I said we didn't have any examples of best practice, that is specifically of local governments reaching out about AI. I actually have lots of experience and lots of examples of best practice to share for this next stage of work that you're talking about. So I'll quickly touch on those and then you can pick up with them with me offline. So one of the things in terms of thinking about, your citizens and why they can't record and why that's important to protect them. So I do think it's really important to tell people who can record and who can't record and all these who's and what's and so on. But one thing that we found that's really important is to tell people why they can't be. And actually the why behind everything is the thing that most of the time gets forgotten. And that is one of the biggest compromises to trust we found in our in our previous research, is that all that happens if you don't tell people why something is happening in a particular format or why they can't do something that you can, and how that makes the power balance feel unequal, is it just starts their brain racing of well why not? And so they tend to focus on why can't I do this, or why isn't it this way? So being explicit about that is really important. And I really liked your your example of bringing your personal experience into discussions, and I think that we've found that that's really important, no matter how mundane they may feel or how it might make you reflect on your own, like the power asymmetries in the room, because obviously you're not marginalized in the same way and so on. But in open discussions with a group of people that all have different experiences, actually that is the kind of thing that leads to meaningful discussion across a group, where people are able to think about like how they might view an AI system or have questions that are different from the person next to them. And the final thing before I let you go back, sorry, is we did quite a lot of work on how transparency can be meaningful. So instead of just showing someone a system or showing someone a policy or showing someone a set of like code of practice rules, it's thinking about how those things can be meaningful to the people in the room. So I can share a bunch of resources to show you where, like, what makes a specific red line like meaningful to a group of people and so on. So just
that would be amazing, because we definitely don't want a kind of IG. This is that we use these systems and this is the legal basis that we use them on. We want something that's really interactive, and I think relationship-based practice is our model. So it's nice to have that kind of, this is something we're all learning about. AI has come quicker than our understanding. We've had no time to prepare for it, so we're kind of all in it together, and we have our own experiences. Mel, have you got something to add?
Yeah, again, just building on that, I think it's got to be in accessible language as well, that that absolutely with the transparency, but also in easy read format, I guess, in a way, and just thinking about what you guys said earlier about almost the disconnect between the producers and the language that they speak and then the general public, and they might have some understanding, but the language is often, we all speaking English or whatever language people are speaking, but actually there's a difference between there's nuances, isn't there?
Definitely. And I'm a big believer in that this means this, so you're given a real world example of that just explains it as simple as possible. Thank you. So the other thing that we are quite interested in is where we're seeing that AI has the opportunity to give families a voice where they might not have before. So anecdotally, some teams are experiencing more complaints, and I know quite outside social work, it's a thing that people go, oh, you can just get AI to write a complaint, and that can be a positive. It can be a you felt unable to express how you feel. Could AI assist them in that way? Can it help them write applications for things? And that's very much an open question at the moment that we'd like to explore a bit more. Also, if you're as a practitioner writing reports, can you use AI to say, can you make this simpler for this family to understand, so you can adapt it a bit more? So yeah, co-production we've talked about quite a bit, and also helping families use AI safely as well. If we're having to talk to families about our use, that's a really good way to model safe use and have those open conversations about what they're doing. I think it's really key what you said, Mel, about considering any trauma that they might have experienced and how that might again open up conversations about their own experiences. So we want staff to be really well equipped for that to happen. So yeah, really got to think about data privacy, trying to be clear, and like you say, Susan, with the why is our Copilot built-in system secure, but we wouldn't say to people, yeah, we'll pop it in ChatGPT. So kind of being able to make that really clear about what's secure and what's not, and what happens to their data if they're to use it. Also thinking about signposting, simple guidance that they can use for their benefit, and also another quite useful thing that they might be able to do is using something like ChatGPT to say, in East Sussex, what support can I get from my son who has ADHD? So where they might be able to have better access to our services because of tools like AI. So we really want to think about those. And I loved what you said, Susan, about the upcoming thing next month. I think that's probably going to be our starting point. That's a really good thing for practitioners to share with families and get the conversation going. And then, of course, we're aware that there's some government-funded that's not the same thing, is it? The government-funded, that's a different thing. So they're being developed, and again, we want to be making sure that we're making our families aware of that and encouraging it. I think, was there a chat question, Erin? Oh, that's great. So from personal experience, primary schools are already teaching safe use of AI with pupils, and I think that's probably right, because my partner's kids quite often mention AI and are seem to have quite a good handle on it. So that's really good. And actually, what would be good, Lucy, is if we tap into some of their resources and kind of so that we're using the same language and the same advice. And then Susan, DFE supported guidance is actually really very good. Awesome.
I'll try and share a link to it, but the resources are really very good.
Yeah, cool. So we also want to think about how we could maybe use it with children and young people, exploring scenarios where they have mistrust, where they might use it as a starting point. We learnt yesterday that sometimes children don't feel able to ask an adult about something, but they might feel able to ask AI, and then that might lead them into then going and talking to an adult. Obviously, there's risks there if they only ask AI, but if it becomes a stepping stone, that can be something that's really helpful. I think we quite often default to having a disagreement in families and going, well, I'll Google it, and we kind of trust that answer, don't we? So maybe there's a thinking, particularly teenagers that don't want to ever listen to what adults say. It's like, well, let's see what AI thinks. And then the important part of that is really developing that critical thinking skills with them and helping them support that. So AI thinks that. What do you think? What do you think about this point? What do you think about that point? So there's potential there that we think we can try and use a bit of what we're doing to support the use of it for social workers and how that might spread out to children and families. Got a hand up. Claire.
Hello. Hi. I've got a question. Have we ever actually asked or do we know the answers to what ChatGPT actually says to young people if they were to disclose something? Do we know what they advise?
It will vary every time you prompt an AI platform. You will get a different response, even if the question is the same. There will be different nuance to it. So yeah, it will vary.
Was there have you seen kind of any positive outcomes, they've said you need to talk to children's services or you need to tell an adult, or have you kind of seen any responses like that or not? Yeah,
I think certainly like the Copilot personal version around health questions will go onto the NHS website, get the answers there, and then go, you probably want to discuss this with your GP. So it seems to be relatively, they try their best, but we also we know what social media can be like, and we know how certain platforms, and children might not use ChatGPT, they might use another one. So it's kind of a little bit of a hit and miss, but there has
been quite a lot of research we talked about yesterday into how young people are using it in scenarios like that, and it's a real, it requires that balance. So as Emma said, if it's a stepping stone to being able to talk to a trusted adult, then that's good. But if they're just staying in that AI arena, then potentially there are a lot of risks. But we haven't got any local anecdotal evidence of that at the moment.
Okay, yeah, I'm just kind of wondering, I wonder what that experience looks like for a young person. And I guess, are you kind of working with the youth council and things like that? Are those questions kind of being asked to them?
Yeah, so I met with a couple of the Children in Care Council to talk about AI, and that's part of the recording of the webinar yesterday, but I can share that link to the video afterwards so you can see what their thoughts are. But yes, definitely, and I'll talk about it next, how we're going to be involving children and families.
Thanks.
I think it's definitely one of those that it's very much an unknown,
Yeah.
but we're really interested in it, and it can even be a bit of a conversation starter just by saying, what kind of things do you ask AI? And if they say, well, I ask it about what to do about my boyfriend, then that has started the conversation. So, you know, then you can be a bit more curious and go, oh, what kind of things is it telling you? But definitely watch the video of yesterday's one, Claire. You'll find it really interesting. Okay. Is it me or is it you, Lucy?
No, it's me. So we've already talked about co-production, but we are really committed to producing really clear, accessible information for families about how AI is used in our work. So not technical documents, but something that's really accessible, reassuring, and genuinely useful, so that we can really help build that trust. So we already have really brilliant participation structures in East Sussex. We've got the Youth Vocals, Children in Care Council, the Care Leavers Council, parent forums, and other lived experience groups. So our intention is to use these spaces to co-create guidance for children and families so they can help shape the language, the messages, and the boundaries. And everything we learn through that co-production will feed straight back into our interim AI guidance. As we've said before, this guidance isn't a one-off static document. It's going to evolve as our approach evolves and as technology develops, and we hear more from children and families. And it was really interesting, Sheffield's work highlighting that the marginalised groups are often excluded. So I think that's something we need to take into account, because those participation groups don't necessarily include those, for example, migrant families or Gypsy Roma. So we need to have a good think about that. And so families really want explainability and to be involved in shaping how AI is used and have real clarity around the boundaries. So we want the guidance to really set out what families can expect from us when we're using AI, and really importantly, what it will never do. So, you know, for example, we're really clear in our guidance that AI will never make decisions. So, as we've said, co-production is about trust, transparency, and equity, and we can only introduce AI safely and ethically if people, those most affected, so children, young people, parents, and carers, have helped shape what that looks like. Emma.
And I think in terms of what we you know, there's lots of unknowns at the moment, but what we know for certain and what, you know, we can be quite clear on is that AI is never going to be used to make decisions or risk assessments on families. So it is not a decision-making tool. All the sensitive information is only used in approved ways. So we have our specific product that we can use where sensitive and confidential data is held securely. We don't use other platforms, and output is always checked for validity, bias, accuracy, and it is edited so that whatever the output is the practitioner's work. AI might be used to help edit it and make it, you know, word it better, make it more succinct, turning notes into something that's well written, but it is always checked, and it is always the practitioner's work at the end of the day. What we need to think about is what we may get is families saying, well, they want to use their own AI. So that is something we need to start really thinking about. What kind of responses are we going to give to that? What kind of, I think like the why is really important. We don't want them recording a meeting and then putting it into ChatGPT. But, you know, and how can we say things like the way we record it is secure, so we can do that on their behalf. It's a whole lot of things to think about, but yeah, definitely an interesting topic.
So now we'd like to really start the conversation. As we've said, I'm just sorting out some breakout rooms to put everyone in. I'll just finish that. So I can't do it automatically. Okay, so as Emma said, it's really early days. We don't know all the answers yet. You know, we're learning alongside everybody else. But what we do know is that we want to develop our approach alongside practitioners, children, and families. So I'm going to put you into breakout rooms for 10 minutes, and I'd just like you to have a little think about, you know, the things that we've discussed today. So families recording and using their own AI tools, and how AI could empower families. What do you need to feel confident to talk to families about using AI, and how we can ensure an inclusive approach? So I'll paste that slide into your groups, and if I give you 10 minutes, and then we can come back for a bit of feedback afterwards. Has anyone got any questions before I send you all off? Can we go to Mel's group to start with? Mel, what did you discuss?
Interesting conversation, actually really helpful and really thought-provoking, and I guess we kind of touched a little bit on some of the areas, and thinking about how AI could maybe empower families to share their voice in a way that maybe is more assertive and might help them to remove any aggressive tones or any strong emotions that might be interpreted as aggressive tones, but also rather than taking a passive role as well, and not actually, you know, sharing their thoughts and feelings. And then we kind of spoke about feeling quite unsafe with families if they were to be recording us, and actually needing some very clear guidance and transparency around that. And then the bit in the middle, it's just come back, I jumped, apologies group, that we spoke about how it's been in personal experience as practitioners in our personal lives, like using it to help navigate communications and systems with other organizations, including schools and other areas around kind of maintaining that communication, and, you know, helping you process, because sometimes there's a lot of traffic in terms of communication, and it can be quite complicated, and helping to simplify some of that process and help you understand some of what they're trying to say, and then help you say it in a way that they understand as well. And anyone else, please feel free to chip in if I've missed something. But it was a very good conversation.
Sounds great. I really love, you know, that kind of idea around, I want to tell my social worker, key worker this, but how can I say it in a way that is going to be more productive than what I might come out with? Then you've got the risky side of that, of how do I reassure my social worker that my drinking is safe? You know, and that opens up a whole nother kind of door that we need to really think about. But yeah, it's a really fascinating ground. Thank you.
Right, room 2, Claire. Is Claire still here?
Hello.
Did you want to feedback? Did you want to feedback for your?
Yeah, we did. We got cut off a bit, but we did have like a discussion on what feels safe and unsafe. So we spoke about being recorded ourselves as practitioners, and like how you know, we would need to feel skilled in knowing about all of the not just Copilot, but all of the other kind of AI tools that service users or families choose to use. So we're kind of fully informed of the risks or, you know, benefits that AI system has, to know that, you know, to firstly be able to advise them kind of correctly, but also like in knowing that, like your own, like personally as a practitioner, like the way that, you know, the risks and the of what being recorded is going to be on that particular system, and that actually, like, there just need to be kind of a bit of a disclaimer maybe before, or working through with the family about what that would look like if they did want to use their kind of own AI. Because a lot of thought might need to go into that, especially if you hadn't heard of that system before, or anything. What else did we speak about? Wait there a minute. And it would also kind of depend on the context of where it's taking place. We also, I'm sorry, this centres a little bit more around feeling unsafe, but we talked about, would it hold service users back from making a disclosure during a visit if AI was to be present? I think we likened the knowing that AI is recording in the background creates that extra layer of being careful in the conversation that you have. Like, would that impact the conversation? Maybe it would, maybe it wouldn't. Maybe you would notice it at the beginning, but as you kind of like have an in-depth conversation and the social worker is more present, would it actually be more free-flowing later down the line? I think there was just like lots of unknowns, really.
That's a really good point, and what we maybe need to think about is empowering families to say, can you stop the recording, because there's something I want to tell you off the recording, and then you go back to your old way of like, okay, that's, I need to write down what you're saying to me here because this is important. And because that's a really good point, because it does, it's unpicking why might we feel uncomfortable saying something with a recording. Is it because it then becomes more real? Is it because we're just conscious of where that then goes? And it's a good one. It's a good one, Claire. Thank you.
Okay. Anything else there, or okay? Room 3, Mark. Did you want to feedback?
So the recordings, I think we've already covered in sort of like the training. Obviously, there are AI open sources, and there's a breach of confidentiality where if people are talking about personal things, mentioning names, etc., that could be accessed through an open source. Using their AI tools, I had a colleague approach me. We received a referral from a school where I think she was about 3 or 4 years old, something like that, had decided to fill up her own hot water bottle with a kettle, put a scalding burn down her leg, and the school referred in on Monday because it was all blistered, and it transpired that when the child did it, mum took a photo and put it through ChatGPT to see if she needed to seek medical advice, and ChatGPT said no. So she just went to the pharmacy and got a cream to put on it. So that is definitely unsafe. I mean, what I was saying was that AI is a tool, but it doesn't dismiss or substitute the professional's opinion on seeking proper advice. So we would need further guidance around, why our systems are safe, how it's recorded, how it's kept safe. It was brought up about the little green shield that we've got. That doesn't mean much to anybody apart from us. We need to know where it's stored and how securely it's stored. Empowering families. Obviously, again, going back to my experience, using it as a tool but not as a substitute. To use it for advisory purposes, but not an end result. We need to be looking at empowering families on using AI, see what is available, say in East Sussex, getting advice, but not substituting it for a professional opinion if they feel that is needed. And we got as far as the confident bit. So we need more training, we need more understanding, more presentations like this, so we can confidently go out and work with our families and confidently say this is how we're recording, this is how we're using it, this is safe, and this is how we suggest that you use it as well, and we need more sort of like robust policies around things like that.
Definitely, that's great. Thank you, Mark.
A really good example, Mark, and it is that kind of if you use AI to replace your own thinking or professional thinking, it becomes unsafe. If you use it as actually I think my child needs medical attention, and I'm going to ask AI and it's going to reassure me that I'm doing the right thing, or actually then it's going, no, you don't need to, but I don't agree with that, I'm off to the hospital. And that's what we've got to teach our practitioners, you know, the output of it. You've got to take the overriding decision, but also with our families and children, that it's not the answer all the time, and it has got an authoritative tone that for some of our vulnerable families, that's really hard to get them to then challenge it. We might find that easier as practitioners that are confident in what we're doing to say, no, I don't agree with the output of this, I'm going to challenge it. But what do you do if you're a parent that feels that that's almost an answer from a medical professional, because it's not a medical professional? And I think they're the things that we need to be clear on, is they're not people. AI is not a person. It's not got empathy. It's not got any expertise. It is essentially a statistical machine. It's searched the internet and come up with the best possible answer it can do. Doesn't mean it's the right answer. That's a good example. Mark, go for it.
It has no responsibility.
No responsibility. Yeah, that's true.
And you know, if we turned around to somebody and said, no, I think you need to take medical attention, and they didn't take that attention, then, you know, we can record what we told them to, and we hold responsibility for that. But if the parent didn't take them, then they ultimately hold responsibility. But AI doesn't hold any responsibility for what answers it gives.
That's a really important message as well. Yeah,
it is a really important message, and also it will answer even if it doesn't know. So a practitioner has integrity to go, I don't know the answer to this one, I suggest you ask your GP. Whereas it will try and please, so it will try and give you an answer, even when it might not quite know. But there's also, you can, I used it the other day for my cat. I've got a very, very old cat, and it kind of initially said, no, that's fine. And then when it asked more questions and I gave more answers, it said, oh, actually, no, that's a bit more worrying. So there is always, it will give you an answer, and then it will say, you know, can you give me more information about this or about that? Which is what, you know, you'd want. So again, some families may just use it in that, I've got an answer, that'll do, I'm off, rather than that scrutiny of, doesn't sit right, what about this, what about that? So it's a really interesting one, and it's definitely one where we're not ready to encourage people to use it or in any of these ways. At this point, we're very much saying these are the things that we might see it could be helpful. And at this point, I think it is just curiosity and you know, sharing with families that exactly what you say. It's not responsible. It's not a human. It can't think in a very nuanced way.
No.
Yeah. Cool.
Okay. And Verity, do you want to feedback for room 4?
Yeah, not to be repetitive, I think we had similar concerns about families recording and using their own AI tools. Definitely would like some very, very clear guidance, concerns about where those recordings may go, what might then be done with them. But I suppose that's not much different than being just verbally recorded. We talked a little bit, I suppose, slightly off track. We talked about shared experience of AI being used in regards to people applying for jobs that we've started to notice. We were asking each other about where it was coming into our world already. So we kind of acknowledged that. Where we thought it could empower families and sort of have a better understanding, stronger voice, just making it more accessible. We were talking about, you know, more of a level playing field, that any local authority website where you want to go and find where do I go and, you know, which department where, you've got to have a level of confidence to play through what is probably quite a large website. So yeah, it was kind of recognizing that actually that could be a real bonus that could potentially make services far more accessible, easily accessible in that sense, or knowing where to go. So that was positive. I don't know how much we talked about what we need to feel confident. I think we just need increasing information. I was talking to Sarah about the fact, you know, I definitely have at least one young person in my side of the world who is using kind of ChatGPT as a friend. which is quite sad. And it's looking at how we kind of delve into that. And I suppose the biggest thing that we do is trying to be curious with young people. You know, it's an ever-changing, very, very fast, you know, doom scrolling world that I've got an answer, move on. And it's to try and encourage critical thinking is something that feels like it is being watered down, for want of a better word. There's less of that. I've got my answer, I'm off.
Yeah, and that's absolutely fine if you're asking it whether you should prune your garden, you do your gardening at this month or next month, and if it gives you the wrong answer, never mind. But when it's something that's serious, it's a whole different ball game, and I think that's what we want to try and build, that there are times when you need to be really critical of it. Interesting, you were saying about the website and making it more accessible in terms of what services we've got, and going back to Claire's point about we haven't really got any control what response you'll get from ChatGPT. So you might get a really good one, and it might say, your local children's services will help you with this. Whereas if it's on our own website, we have a bit more control over it, and it only points to the information we point it to. So we're doing a little bit with our licensed AI Copilot around where we point it to only our operational instructions or our single source, so that for social workers, it's giving the answers that we want it to, rather than what the internet may come up with. So there's, it's about those products as well. Not that we've got them in the pipeline, have we, Lucy? But
no. I mean, some local authorities are way ahead, and they've got bots. They've got bots that sort of are that front door and sort of signpost off, or so there's less demand into the system. But I mean,
because then you could point a young person in that direction and say, if you don't feel able to talk to me, you might be able to put it in here. In terms of what you said as well around audio recording, so audio recording is slightly different, because they can if they were to make an audio recording and keep it for their own use, that's very different. But once you put it into ChatGPT, it's out there. It's out there slightly differently to how you put it on, if you put it on Facebook or something. And they're the things we need to think about. It's like, what does that mean for people, and how do we advise them or be clear with them around what they can and can't do with that data, and what happens to it. So loads of questions, not many answers, sorry.
I think it's really useful to have to hear from practitioners about what your concerns are, and we've heard today from you about things we haven't even thought of, and that's so valuable. So thank you so much for that. Well, we've just got one more slide, and that's talking about what next. So really our first priority is around that strong governance. So before AI is ever used with families, we need a really robust process in place so that we're confident it's safe, ethical, lawful, and in line with our boundaries. We've talked a lot about trust and public voice, so we are going to move forward with thinking about how we can co-produce guidance with alongside those participation groups. And we know that you've talked about that practitioners need confidence in explaining AI to families. So again, we're going to think about support that you'll need in order to do that, maybe practical scripts or conversation prompts as well. But before this becomes business as usual, we will work with a small group of practitioners to test the approach in a safe, supported way. So we'll be able to understand what works, what doesn't, and what support you'll need. And so, ultimately, our next steps are about trust, safety, and shared understanding. So, it's really important that that the children and families feel supported, but also that you are really confident in the approach that we develop and move forward with. So, has anyone got any questions at all, or?
Erin's put a comment about giving how practitioners can give real life examples to families where AI was used as a negative impact, which may help them understand the gravity of when it goes wrong. And I think that's a great example, and also like balancing that with good examples, and
Yeah.
and being able to, but being confident and feeling safe in our good examples, that we're not
Yes.
leading them down a path that we may later not
Yeah.
want to encourage. So yeah, I think it is about that. It's about translating it, isn't it? So rather than some technical jargon about data security, it is about your information and what happens to it. And Mark, you got a question?
Yeah, it's me running a little bit far ahead of everybody. We were talking the other day of the use of AI in 365, and you created a prompt. Would we be looking at creating team prompts or a council-wide prompt that we write our recordings in a particular way, like a trauma-informed approach that's child-friendly, etc.? Would we be looking at something like that in the future, where everybody is recording along the same lines, so it is more easily accessible?
It's a really good question, and I did the example one. I think it needs tweaking. I mean, as people are using it, I'm more than happy for somebody to send me a new and improved one, because I think it is such early days, and we're very much playing with it. And there's part of me that thinks we definitely need a kind of template one that gets people going, but I also don't want to take away from the individuality.
Yeah.
So I want people to add to it their own particular style. I quite often in my prompts will say, get to the point, because I don't like the sometimes American go around the houses that Copilot likes to do. I'm a bit more straight talking, a bit more blunt. So we don't want to lose the practitioner within that, but we can have key things that is about, prompts that are helpful. So with the writing to the child, I went through several different attempts with it, because it kept trying to write me a letter for the child to read now, and it's like, no, it's about writing the case note as we normally would, but with trauma-informed language, in keeping in mind that the child may read it in 10, 15, 20 years time and get a sense of themselves within it, not I'm off out to visit this 3-year-old and this is what I'm going to say to them. So I think it's really helpful if we're doing that work and we're saying that this works, but that the kind of the content, the tone, people can add in, they can write their own perfect case note that suits them and go, using this style, turn this into a case note, although sometimes it likes to merge the data, so you've got to be quite careful with that. But I think at this stage it is about playing with it, but I would like us to have something that's at the very least a starting point that is the basis of what we consider good recording. But yeah.
So, and we have got a whole range of prompts that we've developed so far to support the uses that are approved. But yeah, as Emma said, they will, everyone should tweak them to meet their needs. But also, as the technology advances, they will need tweaking anyway, because you may not need to be quite so detailed in some of the more complicated prompts, or phrase things in a different way. So as technology moves forward, we always need to keep thinking about whether we're still getting the best results from those prompts.
I mean, we learned the other day, didn't we, Lucy, that we can probably take out the use UK English, because that's now finally being set by Microsoft. So it does change at quite a rate, and sometimes people don't use the prompts because they find they've just got a very small bit and they just need to say, just rewrite this so it flows better. If you've got a particular, so I'm dyslexic, so my words do not flow at all, and so I need it to turn everything round. So quite often I'll just say, just make it flow better, make it make sense, that kind of thing, and that's all I need it to do. So I don't need the huge prompt that explains what my role is and what I'm trying to achieve. But there's other scenarios where I have to really have a thoughtful prompt. So yeah, and it'll be interesting to know whether people are using the preset prompts or whether they are just kind of doing their own thing. So feedback is very, very welcome. You're more than welcome to email me and Lucy. We're also keen to build up our AI champions group. So put your name forward. if you're interested in being part of that. And as Lucy said, we are going to be running a pilot with Magic Notes. Magic Notes is a social work led AI model product, and that is quite a lot actually about pre-designed prompts, isn't it? I think it is a lot more structured as far as we know.
It is. It should be a much smoother user experience. So yeah,
that's the idea. So we're definitely keen for anybody who's keen to try that out with their cases.